Hey everyone, my name is Dr. Nick Housley with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
It bothers me that neuroplasticity is true and we just don't have the tools to harness it.
Mhm.
And we don't know the methods. And even the methods that have been discovered are so removed from people because doctors don't know. We can't get the technology down into the people's houses. We can't, like, there's things that exist today that we know work and people are not having access to them. And that bothers me. So immediately it's what jumped out at me when I saw your website and the product, even though there's a number of patients of mine that won't benefit from it because of the mental impairments that they have. But I still like the concept that it's a subscription-based model and it's in the house and it's fairly easy to use
Yep.
and it's not too cumbersome.
Mhm.
And I'm very excited to offer it to my patients and tell them, listen, this is another option for you.
Yeah.
Um, and besides for my patients that actually become my clients, because I'm out there in the community, people ask me all the time for ideas because they don't know exactly what I do or where my line is. And so I have no problem giving out this information even for non-clients, but just I like to spread the gospel, as they say. Like if it's good, I want
Yeah.
people to know about it.
Yeah.
So why did you end up not being a regular physical therapist?
Mhm.
How did you
Yeah.
cut away from the pack and decide not to just do the vanilla therapy that everyone else is doing, and instead, I'm going to be cutting edge?
Yeah.
There's so few people who do that.
Yeah.
So
I
there
mean,
must have been
I think
something motivating you.
yeah. So the without going into too many details for too long, um, I was a professional bike racer for a long time. And the reason I stopped bike racing was I had really bad crash where I basically landed on my head at about 35 miles an hour and had a traumatic brain injury. And before that, while I was racing professionally, I was a pre med student at the university. And after my injury, I had a bunch of surgeries and went through rehab for 6 months, and then ended up switching to rehab because I had a much better experience with my physical therapists in the hospital.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neurorehab.
And what happened is I graduated my undergrad, took me an extra year, but I was able to do it. And I went into PT school and I gravitated immediately. I had a vested interest in understanding because I was the one who was living through the process of plastic changes in my brain. I experienced that firsthand. Um, and well, we all experience it, right? Because we learned something, right? That's neuroplasticity technically, but like seeing a responsiveness to an injury, an insult was a unique point. And I was trained like many other therapists was, but I was able to kind of gravitate to the neuroscience world. Had a number of serendipitous events where I had the fortunate opportunity to work with some really good um, clinician scientists, and I was also the one, frankly, who in my training was getting in trouble a lot because I was the one who was asking, well, why are we doing this? Why are we doing this? And I keep asking questions until the point when the clinical instructor or the professor said, I don't know why. And I would say, well, this is just unacceptable, right? There has to be a deeper level to something like, and so insofar as I was kicked out of a number of classes, actually, funny enough. And then someone basically indicated that, well, you should probably go get a PhD because that's, if you really want to know the answer to these questions, you have to be able to ask them and um, be able to develop a scientific approach to answering those fundamental questions. And so that's
Mhm.
when I went to go get the fundamental training in how we ask these deep questions. And through that process um, of formal training, you basically learn how to be exceptionally critical and don't take someone at face value just because some, ivory towered, whatever, physician, gray haired, whatever, tells you something. if it doesn't make sense biologically or there's no premise to it, you have every right to question it. And I tell everyone this to my statements. I don't want you to take what I say as gospel or whatever, right? I want you to challenge me. I should be able to defend my positions. Everyone should be able to, because there's always the potential for evidential support to change. And that sort of just that fundamental hunt for the truth and that data, that knowledge, is kind of really what drove me to this path, I guess, that I find myself on now. And of course, throughout that, I was given opportunities to perform primary research and using tools that were pretty cool to help people recover their function. And, you know, going through the process, the rigorous trials of figuring out, yeah, do these tools do the thing we think they do? And are they safe? And when we continue to ask those questions over and over and over again, you know, you get really confident in something working, right? You know, I'm really confident that gravity is a thing, right? Every day I wake up and I'm given more evidential support that gravity is in fact true, right? or those sorts of things are true. So that's kind of how. I mean, probably more details than you ever wanted to know, but that's
No, this is important.
Yeah.
This is a good basis.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.